Once again, a very warm welcome to this webinar on behalf of the Center for Budget and Governance Accountability and the Feminist Policy Collective. CBGA is an independent non-profit organization enhancing transparency and accountability in governance through rigorous analysis of policy and budgets and fostering people's participation in public policy processes by demystifying them. CBGA is committed to work on gender justice, and it works closely on how the strategy of gender responsive budgeting or gender budgeting is being designed and implemented by the union, state, and local governments in the country. The Feminist Policy Collective, or the FPC, is a coalition of organizations and individuals with the vision of transforming the policy and financing agenda to achieve women's rights and gender equality. It has some of the leading feminist scholars and activists in India as members of its core group. The FPC has been engaging proactively with issues of public policies and finance in India towards transforming those for gender justice, paying special attention to the gender issues in the wake of the COVID-19 pandemic. CBGA is one of the core members of the FPC. Now, coming to the context of this webinar. So the gendered impact of the pandemic, especially in countries of the global south, cannot be highlighted enough. Women have been hit the hardest. Persons of marginalized gender and sexual identities were particularly vulnerable in this crisis as they were subjected to stigmatization, discrimination, and many other challenges. With respect to employment and jobs, this group of people in particular has been disproportionately affected with employment loss, income loss, increase in domestic work, as well as increase in unpaid care work. The crisis has hit more people working in the informal sector, the service industry and care work, where women are anyhow overrepresented. Disruptions in access to social services, reproductive health care, preventive care, and access to medicines and treatments has particularly affected women and other marginalized gender and sexual identities as they face new obstacles when seeking health care. Education was also heavily impacted with school shutdowns. Girls who already faced barrier to education in many settings had to now gain access to internet connections to devices just to receive basic education. Many also had to drop out of the formal education. The safety was also affected with increased rise in gender-based violence, a lot of which has not been captured. Through the pandemic, governments across the world have introduced policy measures to mitigate diverse aspects of the crisis. The majority, however, if you see, have failed to address the gendered needs and challenges of people. As countries move forward on their recovery effort, it is necessary to keep in mind that gender-responsive policies and financing are key pillars for inclusive and sustained recovery. Also, the way to address a lot of the issues requires an intersectional approach that recognizes the hierarchies of identity, gender, caste, and class. So the webinar today by CBGA and FPC aims to bring together voices from diverse contexts and regions to discuss the gender responsiveness of policy responses to the pandemic. We want to delve into the impact of the pandemic on women and persons of marginalized gender and sexual identities, the challenges moving forward, the kind of policies that can enable a more inclusive and equitable recovery. So without wasting any more of your time, let me start by introducing you to our panelists. And before I do that, let me also mention that two of our panelists today, Clelia and Chennai, are also our colleagues from the Financial Transparency Coalition Southern Regions Program. The Financial Transparency Coalition, or FTC, is a global consortium of civil society organizations working on issues of global financial transparency and tax justice. So let me now start by introducing our panel. We first have Professor Ritu Diwan. Professor Ritu Diwan is the Vice President of the Indian Society of Labor Economics, Vice President of the Indian Society of Agricultural Economics, Visiting Professor of the Institute of Human Development, co-founder, co-convener of the Feminist Policy Collective. She was the first ever woman director of the Department of Economics, University of Mumbai, and the founder member of the first Center for Gender Economics in Asia. She has over 150 publications, including 45 books and monographs, encompassing a wide range of issues. She was the member of the Feminist Economists Group for engendering the 12th and 11th five-year plans, as well as the subgroup on gender and macro policies appointed by the Planning Commission, Government of India. We also have Chennai Mukamba. Chennai Mukamba is a policy research and advocacy manager at the Tax Justice Network Africa. She is responsible for leading the policy unit and coordinating the Institute's research and policy engagement at regional and global levels. She also oversees the institution's technical backstopping of TJNA's national level advocacy. Most recently, Chennai was elected to sit on the board of African Tax and Women Network as the vice chair. We have Clelia Garcia. Clelia is a member of the tax justice team at the Latin American Network of Social and Economic Justice, also known as Latin DAD. She is an Ecuadorian and has a master's in economics from the London School of Economics and Political Science. Her experience involves positions in public service, the academy, and with NGOs, all of them focused on revising the paradigms that guide social and productive interactions and mobilizing to break them when necessary. In today's panel, we also had Liddy Nakpil, but unfortunately, she was unable to join the webinar because she's unwell today. So coming to our panel, coming to the session, to understand the nuances and the intricacies around the gendered impact of the pandemic in different regions, it's first important to look at the different questions around the same. Has gender responsive recovery been a priority for the governments? How have policy responses addressed the issues faced by women and persons of marginalized gender and sexual identities? What are the gaps and what should the ideal policy responses be? So, based on some of these questions, I'll first request Clelia to share her views on some of these questions, giving us our perspectives, giving us her perspectives on them. So, Clelia, I'll start by asking you very quickly, what were the policy responses in the Latin American context? And has gender responsive recovery been a priority for the government? Also, what have been some of the key issues faced by women and persons of marginalized gender and sexual identities through the pandemic? And also, like, if I may add one more bit to this question, what, according to you, have been some of the relevant or outstanding initiatives in the region which could be replicated across?
Thank you, Sarah, and thank you everyone for being here, for being ready to discuss this, which is such an important matter, definitely. I would like to share my screen. Please let me know if it is visible now.
Yeah, it is.
Super. As Sarah said already, I am part of the Latin American Tax and Debt Network. So my examples and my thoughts come from there. This is the roadmap of this. I would like it to be more of a conversation, but the limitations of this, like the tools that we have now, which facilitate for on one side, but also limit some others. So the first would be to think about what we did, revise in general the response. The second part would be to check on the implications, to see which results we have from there in terms of especially gender topics. And then the third would be to revise some examples, specifically on the good side, the ones that we think that might be replicated or at least considered to be adjusted and tried again, right? And then the fourth would be proposals in general in terms of developing public policy, especially giving context as critical as the one that we had with the COVID pandemic. In terms of response, just give me a second, please. Here, super. So we did have lots of interventions. It was not necessarily that there were not actions regarding first social response and then response to women needs. I will say this because I will explain a bit later, but First of all, in terms of social components, even in number of measures, some countries only represent like 15. I'll get back. In terms of expenditure, some countries only have 15% focused of the total budget designated to respond to COVID to some sort of, social or marginalized groups needs. And this is a problem because, as probably we do coincide, probably not, but the most vulnerable ones are the ones that need more investment. And if we think of a society as being as strong as the weakest links, as there is a say, there is a huge problem in the sense that any investment that is done within the productive sector, that is done within even infrastructure, will not be efficient enough if this social conglomerate is not working properly. And then another, getting a bit under that in terms of gender sensitiveness, when revising the global gender tracker given by the UNDP, in terms of number, there is like 40% of the measures that are related to gender or have some gender component. But when we revised in the 6 countries of our studies, only 22% had some sort of mention or particularity, including women. And this just in terms of the description and not necessarily including the actual needs, the actual existence of women and other gender-related minorities within the measures. As an example, some programs, including food help, would require for women to go to some far places within working hours where the most vulnerable women would not necessarily be just, they would be trying to find some sources of money for their families, or probably having some task related to care with their children, etc. So, and then having the heavy baskets just somehow to their homes, remembering that at those points there were no public transportation, safety on the streets was even less than in normal situations. So that is a problem. And then regarding economical measures, the ones that respond to unpaid care, were only around 0.2% of the measures. And that not saying about the amount of these measures, right? It could be that just a little bit of the budget was designated to this, but even just considering if there was or there was not an economic response to unpaid care, only 0.2% of the measures had this component. And even within those measures, the problem was that they did not respond to the needs in more of a permanent or long-term way, but on a temporary and on a social assistance concept, right? Under this conception of, okay, I can help you because probably I am somehow good or I'm in a better condition than you, but it is not that concept the one that we are in need of here. And that I will back up that as like that hypothesis afterwards. But the first goal that we as civil society need to make is that we do not have a right to regard social programs as assistance. This is not the way we have to tackle this. And finally, when there are women's economic security measures, those are highly concentrated. And within the tracker, considering the big, like not only the 6 countries that we have, but the whole continent or the whole region in there, only 4 out of 47 countries had half of the measures considering within this definition. What else about the response? I would go a step before this, and when thinking about empowerment of women and other minorities, sometimes we have the mistake of considering just one of several components that we need to really, in the same, generate this empowerment. In the same way that a society cannot have a productive development if there is no social development, if there is no environmental integrity. In that same way, if we try to guarantee some physical safety, in the sense that most of the measures were regarding violence, if we do not have the economic component, if there is no way to provide us with political spaces, with decision-making spaces, if there is no consideration of the emotional load that we have and the implications for the whole system to work, that we do have that load, then there is no measure that will work for real if we do not consider these components, right? But what have we done again? In terms of economic support or economic measures, there was some response. And just in a few countries, there were potentiations of access to credit or to some sort of help for entrepreneurs being women. But then again, even when the measure was defined, not many of those were implemented properly, in the sense that the requirements or did not regard the actual reality of entrepreneurships led by women, right? Sometimes they're more informal or have mainly, the leading person and some others that just come in like in terms of the need or the demand of the entrepreneurship. And then these conditions kept the potential beneficiaries away from the benefits. And then in terms of physical security, for instance, we did have some digital campaigns, we did have some explicit legal penalization. I will talk about this afterwards, and some facilitating instruments. But if we do rely on apps for tackling physical violence for women, the ones that are suffering it the most are the ones that do not even have access to a proper cell phone to support these apps, right? And there are other issues on that regard, especially regarding street harassment, but I will talk about this afterwards as well. And then in terms of political inclusion, capacity building, support, really the impacts or the actual the actual results of this are still under discussion. And then in terms of emotional measures, there have been some care recognition transfers, but not necessarily responding to the COVID crisis, but more in general, and they have not been totally developed yet. And yeah, basically the problems here are investment. We have not seen enough in terms of the priority that this topic should have, and then a shift of paradigms that we need to see and has not been seen yet. In terms of quality and conditions that also are not necessarily adapted to the public that we need to respond to, and weakness of enforcement and channels. In terms of implications, thinking about the 4 pillars that we have mentioned already, the situation is that we still have some gaps to close here, structural, but also regarding the pandemic, and also with the climatic risks that we are not talking about here, but we have to take them into account. The effects of the war, and also even sometimes in our region, we have seen that there are cases where we have gender regressive tax systems, which are also some of our part of our work. And then just taking some other specific implications, we have seen some improvements, to say something, in terms of education, access to education, but we do not have much in terms of quality, in terms of even the focus of women education, because as we are probably better than men in terms of care, because we do that for a living in general. But then the problem with that, with this humanity bias that we have seen, is that it is not compensated in the same way in terms of wage, especially, than STEM careers, for example. And there are some countries, developed countries, that have some improvements there, but it is yet to be seen in developing countries, especially in Latin America, where an hour for a nurse, for instance, is even less than a Big Mac within this international index that helps visualize this problem. And then in terms of labor market, we did have a huge impact with the pandemic. Within the around 24 million women that left the labor force within the region in that time, 20% are still unreturned. And from the ones that have already returned, there are two every 3 women that have returned were in informal ways, and 3 out of 4 within like under occupation. And that, leaving aside the fact that already we are 2 times more unpaid or doing more unpaid work, and that there is a measure of systemic gaps or systemic discrimination within labor contexts. And this, there is 25% more systemic biases in terms of gender for women than for men. And within safety, like physical safety, violence is not only like explicit, actions, but also what we have around in our usual interactions with the world. And this is important because we cannot, or the society cannot, expect us to produce or behave in the same way as a man if we do have still some restrictions that they do not? Who here, being a woman or being a woman minority or a gender minority, has not felt at least once in your life some sort of street harassment? In Latin America, that is huge. And even though I think I live in a kind of safe neighborhood within my city, there is no day I go outside and I feel completely safe when walking there. And that is a problem because it not only affects our, our professional development, because of course it does, even in terms of the more or less formal ways or the more unconventional or contemporary opportunities that are increasing as deliveries. There is a huge limitation coming from this. There is no way a woman can go outside and work within these spaces with the same peace and the same safety or perception of safety than a man. And even within formal enterprises, at least it was around 25% of women felt somehow unsafe, and just one of every three enterprises have some sort of guides around how to behave on this, how to report this, but that doesn't mean that they have a way or a mechanism to put this into place, right? And then in terms of social security, and this is also huge, just try to look at this. 40 or 50% of women, more or less, are within the labor force market. From them, 40% are within occupation, like formal occupation. And from them, only 40% have some sort of social security contribution at some point of their lives. So the problem with this is that, first of all, we live longer. So that means that we have more time within retirement or expected retirement. But then also, as we take care of the family, of our kids, of our parents, we sometimes decide to leave the workforce and decide to suspend our contributions, meaning that we are not able to access social security afterwards. And this is only a problem in terms of not only this later phase of our lives, but also in terms of access to health or some sort of help to cover our crisis, that we all have some kind of personal health crisis in our lives, because we are depending on men to access there. If we have a partner that has some possibility to access there, then we might have some coverage. But then if we as a family or as a group are both in informality or some other underemployment conditions, then the problem is not only for women, but also for the kids and other relatives that are being part of the household. In terms of politics or decision-making spaces, the power is still isolated. Within the private sector, just 24% of the decision-making charges or power positions are in hands of women, regardless of all the benefits of having women within, the boards and decision-making processes. And then within the public sector, the things are not different, because men occupy 2.5 times more power positions than women. And even within the task force that responded to the pandemic, In Latin America, 73% of the health workers were women, the ones that were on the first line responding to the crisis, to the health crisis. But then only one of every four people responding to that, of this task force, were women in terms of decision-making spaces. And this is also just another example of how power is being isolated in terms of gender. For caregiving or mental load, we have, we say in terms of Latin America is not the country where there are more like gaps between men and women in terms of regions, but we are the ones spending more time to activities regarding care. And then where there are some initiatives regarding paternal leave or trying to fight this pregnancy bound that we have seen regarding the gender gap, these are still very, very little. And for instance, if women have on average 20 days of maternal leave, for in the cases that there are paternal leave as well, there it is around on average 6 days only. And then coming to the examples that we have found as important or interesting to check on, in terms of physical security, harassment is, as I said, some of my personal big worries. And there is one place in which there has been legal action on this regard, which is Argentina. And they do have formal mechanisms, they do have legal definitions on this. But the problem is that still conceptually, like culturally, it is difficult for us to come out and say, you know, I do feel unsafe, because that would probably end up on our family, our friends, our partners, limiting our mobility even more, right? Because they care about this when they care. And there are also some other examples regarding this particular issue. So one is in Ecuador, but it was not regarding the pandemic. But again, the mechanisms to implement this were not necessarily the easiest to access for women. And then another example in terms of political decision or decision-making or power positions, if they're not explicit or formal power positions in public or private spaces, there are initiatives that create this as a counterpart with public councils of women that help within the process of policymaking, especially. And yes, these are initial yet. In the case of Colombia, they do have a fund where some private and public actors have invested, so that they do not only have some kind of voice, but also they kind of structure the capacity building within the council, and have, like, they can have a higher power within this space, right? In Chile, that is not the case. But I am not completely familiarized with these two cases as a user, because I'm not living in those countries, but I will relate this to some initiatives that were in place in Ecuador a couple of years ago. And this was having minority representatives within the National Assembly, the Congress. And this ended up being, first of all, a way of twisting politics even more, because the way in which, as there was no like previous stages that were needed to people as citizens to demand to be there, the ones deciding who was there were the ones already in power. So what this worked as was just as an extension of already polarized power. I'm not saying this is the case for Chile or Colombia. As I'm saying, I really like the fact that in Colombia there is a fund that is just explicitly to develop capacities and to help their voice to be real. But then again, just having this experience from my side, for us as civil society to take this into account and to respond to that and to be aware and careful when we are part of this, just so we do not fall into this trap, right? And then as a third example, in terms of social security, there is a measure in Ecuador, but it was not related to the pandemic either, differentiating the care work and taking it into formality in an easier way, like facilitating mechanisms so that women that are within the care work activities, and it's being it just like providing it for others, or even if I provide it for my household, there are mechanisms for me to access social security at a differentiated price, with very low contributions, so that in the end of my life I can access retirement as well. And within my addition to this, also I could have access to all the benefits regarding health as well. So this is super important, facilitating mechanisms. So yes, I do care about women not accessing to social security, but how do I help them into this, right? And then in terms of care work or unpaid care, specifically in Mexico and Paraguay, there were some initiatives that also had but this is more in terms of family care, not us providing it for others. And the differentiation here was to require for women, especially the ones with kids or family, to have super lower time of contributions, and also this not necessarily being continuous as it is strictly stated in the normal social security frameworks. And then in terms of other care needs or basic access to guaranteeing our basic needs, I do like a initiative that took place in Peru, and this was about community pots. To translate it, it was called ollas salidarias, and this was about women making help sustainable. So they took the public help, the municipalities' help, and the private help for some of the members of the community, and the community got organized, and they did make huge pots of food for all the community to access. Even though I will go a step before here, and this was, as the food help, as I said before, did not necessarily make it easy for women to access it. Not all of them could get it, of course, and because of restrictions, because of logistics, because of whatever. And what this implied in Peru, especially in some communities around Lima, is that the ones that could go for it went for it, and others that were probably not going because of care work, they were they took the task of preparing the food and distributing it within the neighborhood. And this was so, it had so much importance and so much impact in terms of the actual needs of the people that it got institutionalized within the municipality. So afterwards, the municipality was the one helping them directly to take the resources into the organized communities. And this helped also spread this good practice. And then in general terms of what do we think that we need to do around this? Again,
Claudia, just so sorry to interrupt. If you could just wrap up on this quickly, and we'll come back to your
this is the last one.
Interventions as well. Yeah.
Super. Just I would summarize this in coherence first. If we say we care about this issue, we need to invest on it. Also, as civil society, I invite us to challenge ourselves, because if this issue has not been somehow fighted totally yet, there is some responsibility on us as well. What is the systematic approach that we are having that is not working? Let's be honest on that. And from there, let's redefine constantly what we do, how we act, and how we help all the stakeholders regarding these decisions of policymaking to hear our voice. That is also part of our responsibility. That's it. Thanks a lot. And just let me, this is my contact in case anyone has any doubt or comment on this presentation.
Thank you so much, Clelia. That was a fascinating and an extremely comprehensive presentation. And, not a lot of us get to hear about, different contexts, different regions, see the numbers that you kind of revealed. So thanks a lot. And we'll come back to quite a few questions in the intervention and the question and answer round. So at this point, I'd like to bring in Chennai to highlight her views on some of these questions that we've been discussing. So Chennai, my question to you is, what have been the policy responses across the African countries? And again, what were some of the good initiatives that were taken? What are some of the policy gaps that remain to be filled? And more importantly, how can we ensure that, equitable, gender responsive recovery, that takes place, keeping in mind the regional as well as the contextual situations?
Thanks so much, Sarah. I hope you can hear me. Perfect, great. I've been having some trouble with my mic. First of all, thank you so much for this opportunity, I think, to share to this conversation with regards to the sort of the African perspective. And it's such a timely conversation, particularly when you're looking at sort of the gendered components or effects really of COVID-19. So really excited to be able to speak to that. Also just to mention that, a lot of what I'll be sharing is drawn from a report that we actually did looking at a number of different African countries' responses to COVID-19. And so I'll be able to speak to that, and of course, happy to share that after the call as well. So with regards to COVID-19, I think most of you will know that the socioeconomic impacts of the pandemic were much more severe than the epidemiological ones. We had many more people feeling the brunt of the economic impacts of the pandemic than we did see, sort of numbers of cases and deaths. But really, the socioeconomic impact severely affected a significant proportion of the continent. And unfortunately, because of the already limited fiscal capacity that African countries had, we didn't see governments be able to respond as effectively as we would have needed them to see on the African continent. And this has broached a number of conversations around, how can we strengthen African governments moving forward to be able to respond to situations such as the COVID-19 pandemic. So specifically to, sort of the gendered components, I want to start with a statistic that I think for me, when I was sort of doing research around this topic, I found quite shocking. So the UN has identified most recently that we have about 388 million women and girls that are living in poverty, right? So those are 2022 statistics. But of the 388 million, 244 of those can be found in sub-Saharan Africa, right? So when we're talking about women that are experiencing extreme poverty, you have over 60% of those women found within the African continent, right? Which really underpins the importance of not only this conversation, but governments to be able to ensure that they're taking a gender lens to addressing a lot of these issues that we face, right? Despite this, you know, when we did this research that I spoke to earlier, we didn't see as much attention paid by governments to gender issues. I mean, I say as much, I'm being very generous. Many governments didn't even pay any attention at all to the sort of the gender impacts of the pandemic. Before I go into the actual figures that we were able to explore, I want to absolutely agree with Clayla. I think there's a number of, you know, effects that women experienced as a result of pandemic that she spoke to, but we're definitely across the board. Clayla mentioned, for example, that, you know, during the pandemic, we saw an increased amount of domestic violence, and this was the same on the African continent. In fact, to use a very specific example, in Kenya, the number of calls for help for women that were experiencing domestic violence went up by about, you know, 30%. And so this is something that was prevalent, you know, really across the world. But not only that, you know, the actual burden itself of the pandemic really fell on the shoulders of women for a number of different reasons. In the African context, for example, over 60% of Africa's healthcare workforce and essential service providers are female, right? I say 60% on average, but this number is as high as 90% in countries such as Egypt, for example, right? So this is just kind of speaking to, you know, the role that women had to play in fighting the pandemic. This is over and above sort of the increased care work that women had to experience, either by, you know, sort of having to stay home and leaving the labor market, looking after children who, you know, didn't go to school anymore because of, you know, closed, you know, systems, etc. And so all of this kind of just, you know, reiterates the point that women really hadn't felt the brunt of the burden, but essentially, you know, speaks to why our governments needed to pay much more attention to the gendered lens of this pandemic. So with regards to the way in which governments responded to the pandemic, we did a piece of research where we looked at 9 different countries. And what we were focusing on specifically was how much of money that governments were releasing was going to areas where we see, you know, for example, women concentrated. Unfortunately, and this was something that was across the board, we saw that most governments actually directed most of their resources to the corporate sector. So when you look at, for example, these countries that I mentioned, our report looked at Zambia, South Sudan, Uganda, Malawi, Zimbabwe, Ghana, South Africa, Sierra Leone, and Kenya. 63% of the resources that governments put out in response to the COVID-19 pandemic went out to support corporates, right? The thinking that there would be some sort of trickle-down effect, which is really not what we saw, right? And so for us, this really, you know, begged attention with regards to where exactly the priorities many of these governments were placing. We were also looking at how much governments placed in terms of social protection measures. On average, we saw governments only place about 20% to various social protection measures. And of course, when you take a look at, you know, who is most dependent on various social protection measures, this is women, right? Because many women don't have access to resources, and as a result, are dependent on, you know, the various services that governments are providing. We saw only 20% of this go to social protection measures. But when you take a look at, you know, I mentioned this is an average, but when you take a look at what that looked like across different countries, in South Sudan, for example, less than 1% of government responses was going to sort of social protection. In Kenya, we had less than 7%. You know, just kind of speaking to the way in which governments were responding to that. We also then took a look at just how much government support was going to the SME sector. The SME sector on the African continent is particularly large, in fact, much more so than the corporate sector. And across the board, we only saw governments put aside about 15% of their resources towards that. You tend to find that the SME sector was one of the most negatively affected by the pandemic because they didn't have, some of the different access to various mechanisms that the corporate sector had, yet we didn't see as much attention paid to that. But I think for us, what was most striking, and I think particularly pertinent to this conversation about gender, was when we took a look at how much governments were setting aside to support the informal sector. Now, within the African continent, and I'm sure this is the same across a number of different regions as well, 92% of the informal sector is women. Right. And so when you're taking a look at the kind of support that governments are giving to the informal sector, this is really support to women that are working within this sector. Only 2% of the entire amount that governments were giving to support businesses, that were trying to, navigate the COVID pandemic went to the informal sector. And of course, when you think about the informal sector, this is the sector that is characterized by a lack of savings, right? A lack of socioeconomic sort of safety nets. And also this is where you tend to see individuals that are sort of living on a day-to-day placed, right? And so for us, this was of severe concern, because when you're taking a look at that vis-a-vis how much went to corporate stimuluses, it really kind of showed, as I mentioned earlier, where government's priorities were. And when you are looking at what that meant, from a gender perspective, it really, really means that there wasn't a significant amount that was being set aside by governments to support women within this particular sector. But also when you think about it, a lot of the measures that were being put in place in order to respond to the COVID pandemic, right? So restrictions on movement, et cetera, also were most negatively affecting the informal sector. Many women, many individuals that work within this sector are really earning for that day what they need for that day, right? And so if they don't have the ability to do that on a daily basis, they're now having to make decisions between being able to provide for their family vis-a-vis breaking the law, right? And so this sector really was the sector that we thought really needed the most support, but really received the least in terms of support from different governments. And so, I think in response to your question, what are the gaps and what should have been the ideal policy responses, right, to ensure sort of swift and equitable recovery to the pandemic? We needed to see most of the support going to those who needed it, right? Which we didn't see. There's a lot of talk as well about, how difficult it is to engage, with the informal sector. I always find this particularly interesting because many African economies are characterized as informal, right? But this is what's being seen as needing to, have special attention. I mean, there's a number of different mechanisms that governments could have employed to access the informal sector. Different from some of the regular channels. So I know, for example, in Zambia, the Revenue Authority, in order to access the informal market, uses various associations, right? Civil society groups, in order to be able to reach many of these who are far to reach, right? And it's not as easy to access. So making use of mechanisms like this really would have helped to allow for much more equitable and inclusive recovery, particularly for those who needed it, particularly in sectors such as the informal sector that I mentioned earlier, is where you tend to find women situated. And the reason this is particularly important is because, when you think about the pandemic and you think about the way it affected the economy, when you think about the way women left not women, but a number of people had to leave the economy, women really should have been central when it came to the thinking that governments were putting in terms of mechanisms to address the pandemic. And so looking forward, I mentioned some of the different ways that governments, for example, could have addressed these issues. What can we do to be better positioning ourselves? I think something that we have seen, and something that is really prevalent across African economies, is that women tend to be absent from decision-making processes and in various governance circles, right? And as a result, that voice, the inclusion of women when it comes to decision-making is absent. And so you then see decisions being made that are supposed to be on the surface neutral, but not really when it comes to implementation. And there's a lot of research that's actually shown that when you put women on the table, you're likely to get much more equitable responses to various issues. And so this is really, some of the ways that African governments can be positioning themselves in order to not have this happen again. And we really, really need to see, African governments recognizing that, the impacts of these kinds of situations are not gender neutral. And there's a lot of research coming out that reflects this, but we really need to sort of start to see that when it comes to policy implementation. So Sarah, I'm gonna pause there. I mentioned earlier that there is a report that we put out, that the report, I'm really happy that Matty's on the call. The report that we did that was focusing on the African scenario really was drawing from a much more broader global report that we did as part of the Financial Transparency Coalition. The trends that we saw in terms of the amounts of monies that governments were giving to corporates, SMEs, informal sector, interestingly enough, were almost a replication in Africa of what was happening at the global level. I think really speaking to, the prevalence of this neoliberalist policy that's affecting us, at a global level. We will be doing the same report focusing much more on a gender lens. I mean, of course, here I mentioned, if only 2% is going to the informal sector and 92% of participants of the informal sector are women, it means that a lot of money wasn't set aside for women. But we will be doing the same research that actually gives specific figures in terms of how much was allocated to women, as well as sort of very concrete policy proposals on how we can be addressing that. Thanks, Sarah.
Thanks so much, Chennai. I mean, you really showed us like a very panoramic picture of, what the situation was and how women across different sectors were impacted, and also kind of emphasized why the governments really needed to pay more attention to this issue during the pandemic. So we'll come back to you in the question and answer round with quite a few, points again. And so at this point, Liddy Nakpal, she was supposed to share a few points with us today about the Southeast Asian and the East Asian countries, but unfortunately she's unwell and she was unable to join this discussion. So at this point, I'd like to call Professor Ritu Diwan, and her observations will be particularly on India, but it will be important as a contribution to kind of understand this issue, even from an Asian perspective. Inviting Professor Diwan, and my questions to you very broadly again are, what were some of the main elements of the policy responses to the pandemic in the Indian context? And what are some of the challenges that are confronting women that should be addressed through the responses that have been adopted? And lastly, again, moving forward, what will be some critical policy measures that can ensure that a swift, equitable recovery from this pandemic takes place?
Thank you so much. Yeah, thank you so much, Sarah, and delighted to be here and delighted to discuss what is happening. And particularly in relation to the fact of the report which has come out, the WHO report which has come out just yesterday, and that is that India had the largest number of COVID deaths due to the pandemic. And this really reflects a whole scenario, I think, which talks about the fiscal architecture, what has been happening in the labor market, what has been happening in terms of monetary policies, etc. So before coming into, the issue of what are the exact challenges and what has been the policy response, I just want to locate the period of time and the period of development in quotes. Actually, growth is, really what we would be talking about, and a neoliberal pattern of growth which exists. And that is, the pandemic came at a time when every single indicator in India, human development indicator, was declining very, very dramatically. You had the lowest female work participation rate in South Asia, the lowest wages even across gender for men and for women in South Asia, it was about 4,000 rupees, which is like, if you see 75 rupees a dollar, it's really very, very low. Also, the global hunger index, India had fallen very dramatically. Nutrition levels, it was already being reported in 2019 that the nutrition levels of particularly women had fallen by quite a dramatic amount. Also, in terms of children, I think the impact on children, for the first time, that the height of children, that is the percentage of children who were stunted, had actually increased instead of decreasing over a period of time. Many other indicators in terms of poverty, you had a percentage increase of the population below poverty. And when I talk about poverty, it's like a very pathetic, about not even $1 a day, maybe $0.50 a day is the poverty line which we're really talking about. So in this context comes the pandemic. And actually, it's of course the impact of the pandemic, but the impact of the policy response or the lack of a policy response on the pandemic is really what made things very, very traumatic, and from which has generational impacts. It's not something which is going to go away in terms of, even if you have much more, increased allocations, or you improve the fiscal, the proportion of direct, indirect taxes, etc. In fact, it's becoming much, much worse. And, when we talk about percentages, I just want to give the number of women. And this is just within the first year, the number of men and women, it runs into millions and millions. So therefore, you also have a huge increase in families who could not afford basic nutrition. Okay, already 75% of the rural population could not afford a nutritional diet, and this increased to almost about 85% of all the households, urban and rural, not being able to afford a nutritional diet because of the lack of support in terms of a more humane or a compassionate policy which existed. Also, if we see how many became jobless, the numbers are huge. It is 200 million, and the recovery has not taken place even after 2 years. There was also a massive increase, and this is something which I find quite obnoxious and extremely cynical, and I think it really reflects the kind of economic policies which are being followed for quite some time, and particularly in the past few years. And that is that, in fact, profits increased by 20% of the major 100 listed manufacturing companies during this period. And this is when sales were falling, people didn't have the money to buy anything at all. And of course, you have at the other end wages falling by even more than what the profit rates had increased. Now, there is, of course, we know internationally that global female job loss is almost double the number of male losses in terms of where jobs are concerned, and that over 40%, I think, of every salaried women have lost their jobs internationally. In India, it was much more, 79% of women and 75% of men. And this runs, like I said, into 200 million at an absolute minimum. Also, if we take specific sectors, and here, of course, female-headed households and transgenders impacted the most. There is, very sad to say, no macroeconomic data which has been collected. There are many institutions, many NGOs, many academicians, individually, collectively, including our Feminist Policy Collective, as well as some of us who have been working on this independently with field work or telephonic interviews, etc. And we have come to understand that particular sectors impacted most strongly. One is the domestic workers sector. Now, this I'm taking in particular because it represents a very large proportion of women and urban women, informal workforce which exists. And these sectors are those who had not recovered from earlier economic policies. One policy which had come in 2016 was that of demonetization, which came within, a matter of a few hours, and where a large number of informal workers lost not only their incomes and their jobs, but also the savings which they had. There is also, of course, the fiscal issue of the change in the fiscal tax architecture with the implementation of what is called the GST, the sales tax, which was increased, which was extremely faulty. and very high, particularly where consumption of goods, where women in particular use, of course, the poor very much so, and within them, the women use much more. So the costs had gone up very, very dramatically. It is estimated that where domestic workers are concerned, almost 90% lost their jobs, and 99.4% used up whatever little savings they had. And the kind of field work which some of us has done is that they were forced to, the poorest of the poor, the most vulnerable, destitutes, they really became destitute during this period of time and sold whatever little bit they had. They sold their vessels, they sold clothes, they sold their mobiles on which, digital India is supposed to be very dependent in these days. And the minimum monthly wages, which was very minimal, fell by another 25% and becomes lower than lower of the South Asia context. More than half the women and almost half of the men did not receive wages at all in terms of the work which they had done. And this is directly in relation to, the first policy response in India of the government was to declare within a 4-hour notice a brutal lockdown, a lockdown where almost 1/3 of the workers in India are migrant workers. And the pictures and the visuals and what we all went through in terms of setting up migrant camps and trying to provide some kind of, but I think also again the fiscal architecture becomes important because their share of the tax kitty has not been given to them for quite some period of time. And this really is a constitutional issue because India is a federal country and it's a union of states. So therefore, the states not getting their share of taxes impacted not only the relief measures of the pandemic policy, but also it impacted developmental expenditure and developmental expenditure for a long period of time. This issue has not been rectified at all, even today, after 2 years. Also, of course, we know health workers, what we call the frontline workers, who were the most impacted, and 85% of nurses and midwives in India are women. And during this period of time, again, the tax issue, and that's why I keep saying the macroeconomic component and aspect is something which is so important when we talk about pandemic policy in terms of the impact, in terms of the possibilities of recovery, etc., etc. And that many of them did not receive their wages over a long period of time. The equipment which was used by health workers, that is whether PPEs or masks or sanitizers, attracted 28% tax. Some of us, we went to court, and fortunately, at least at some level, we succeeded in reducing the taxes on medical supplies, which are amongst one of the highest in the entire world, in fact. The impacts are just huge. The poverty rates increase for men and for women. Women in extreme poverty, which were already 73 million before the pandemic, has now crossed about 130 million. So, and this is extreme poverty, which we are talking about, not just poverty levels at a particular way. And so therefore workers, and particularly women and transgenders and commercial sex workers, are forced to accept any kind of a job. So, when we talk about decent employment conditions, etc., they just don't operate. So we have had instances, anecdotal field surveys, etc., where women in certain states worked 10 hours to 12 hours just for about $0.50 a day. Sex workers who were charging 10 cents an encounter. Because remember, this is also the period of physical distancing. Okay, I'm not using the term social distancing because we already distance socially in terms of community and caste and religion and class, of course. The most fundamental, basic issue. And again, nothing to do with the demand of people, not putting any money in the hands of the people, not ensuring that they were given the wages that they were supposed to be given. There was just a sort of a rhetoric, a statement that yes, employers should please pay their workers, but that itself was not possible. one of the worst impacted was the medium and micro small enterprises. And this is very important where India's development pattern is concerned, because this constitutes, these are all informal sector workers, and this manufacturing sector, which is small and micro enterprises, they constitute 45% of all workers in India and 45% of the exports from India. And they got absolutely no succor. They were allowed credit at, at low rates, but there were no tax cuts which were given. There was no kind of a financial support which was given. In fact, what we had, in spite of increasing profits of the top 100 manufacturing listed companies, was that you had a reduction in the corporate tax. And this is something which was continued even this year in 2022, that this reduction from 30% to 15% has been extended by another 2 years. But this is not where people are employed, and this is not where people need the kind of succor which they needed, or the kind of financial support which they needed. Also, I was quite shocked when I was doing this analysis that even during the period of the pandemic, whatever allocations had been made for in the operative budget of 2021 or even 1920 had not been implemented. And one of the worst which was not implemented was that related to women, and that related in particular to domestic violence, which was extremely high during this period. So we have a fund called the Nirbhaya Fund that is supposed to, protect women from violence. That's an expenditure which is supposed to be done. But 75% or 74% of this was just transferred from the Ministry of Women and Child to the Ministry of Home Affairs, with absolutely no explanation of why this was done. Several states, the fund was not utilized at all. About 80% of the funds were not utilized. This is also where labor allocations were, where social security allocations. There are many departments. I can, share the papers which I have written on this. There is also, of course, I think, a lot which was carried out. I mean, there are many challenges, and I really don't know. I think the challenges themselves will lead to the resolution. That once you recognize these challenges, you know where the resolution should come. And these challenges are huge. One, of course, is the massive increase in unpaid work. And here, when I talk about unpaid work, it is not only the work from home syndrome, which of course applies only to a very, very small percentage, because where do informal workers or physical menial workers work from home? They were all totally jobless. The issue of unpaid work became much worse. One, of course, is that the resolution of unpaid work does not lie only, and even if it does, at a very small level of, in improving the power relations within the family, between husband and wife, etc., etc. But the issue is reducing the huge amount of unpaid work itself. And this can be done only from a macroeconomic perspective in terms of allocations. And in fact, what we had at this point of time, that all the subsidies of cooking energy, clean cooking energy, of clean drinking water, even of fuels, like kerosene, all these subsidies were withdrawn during this entire period. So the increase in unpaid work is primarily due to the kind of fiscal architecture which increased. There is also, of course, there are many other issues, the violence which takes place. And I'm not talking only about domestic violence. Of course, there are reports that it has increased by 171% during the first 1.5 years of the pandemic. But to be seen again in the broader context of the fact that violence against women, against minorities, against the lower caste, against those who don't fit into the new national model, etc., etc., that kind of violence is not only being actualized, it is being normalized. And this normalization leads to, I think, a huge issue which cannot be resolved by increasing allocations or by CCTV cameras, etc. It is something which is much, much more fundamental to this. There are other issues which should have been anticipated, because that's a result from all the, I think, the impact of disaster management, what we've done, and the gender impacts of disaster management. Because remember, COVID was declared as a national disaster in India under an act which exists. And one of it, of course, is the rise in child marriages. This is something which has been reported for many countries, whether it's a time of conflict or civil war or deforestation or displacement, etc. And you have this huge increase running into thousands, at least in the state where I am living. There is, of course, no macro data on this. We'll have to start collecting the data, which many of us are trying to do. So you have young girls and boys of 12, 13, 9, etc. getting married off. So again, you're seeing an intergenerational, a huge generational impact. It's not something which is going to be resolved by tweaking a law and saying that no woman should get married before the age of 21 or 25 or whatever which they want to do. There are also, of course, that there was no implementation of what we have in India called the midday meal scheme. All right. So this is cooked food, which was provided. It's the largest provision in the entire world. And it has been there for a very long period of time and implemented, maybe not ideally, but certainly in many good kinds of ways, it has been implemented. That this was not done by major states, except for one or two, I think Kerala and a bit in Maharashtra and one or two other places where it was implemented. So you had more than half the children, I think the calculation is about 63%, did not even get, any kind of even dry rations, which existed, forget about cooked meals. A decline in immunization, which again means that your health problem where children are concerned, and I'm not seeing children as children, I'm also seeing them as the future workforce. So again, an impact which has again a generational issue. The maternal mortality rate increase, infant mortality rate increase, unplanned pregnancies. I mean, just in that 1 year in 2020, it is estimated that 200 million couples had unplanned pregnancies and no kind of a health system because everything was focused only on COVID at that point of time.
Thank you so much, Professor Diwan. You highlighted some very, very serious concerns, but I think I loved what you said. The one line which kind of was a key takeaway, and probably one of the reasons we're having this session, is that recognizing the challenges will lead to the solution and to the resolution. So with that, I'll now open the floor to audience questions and observations. So there are two ways that we'll go forward with this. The first, if you have any questions for specific speakers or any questions in general, you can post them in the chat box. Second, if you'd like to also speak, I mean, I can see that we have participants from different countries and different contexts. So if you would like to, have any observations or any interventions, or, just tell us a little bit about your context, you can raise your hand and Shuchita or Sumita will unmute you and we can do a very quick discussion, and, it'll be really interesting to hear your perspective as well. So yeah, and if you have any questions, feel free to post them in the chat box or raise your hand. One moment. Yeah, do we have any? Okay, so I think I've got. Okay, we first have Mridul ma'am. So if we can unmute her, and then after that we have Matty Conan. So if we can unmute him as well. So first we'll just unmute Mridul ma'am. Yeah.
Yeah. Good afternoon. I was thinking I should not speak, but I don't know. I couldn't contain myself because so many things happened in Kerala, which don't seem to have happened for the rest of India. And
Mridul, put on your video, please.
So
thanks.
It's a bit surprising because you see, Kerala, of course, we all know was lauded for its intervention in the health sector and also in the economic sector, and we even before the pandemic came, the preparations were already there in place. The hospitals were ready to receive the first person from Wuhan because we had so many students in Wuhan. So I'm saying the preparation and the way the whole state and society reacted, we actually have done a paper on this. We have done a paper on this, me and Dr. Ram Kumar from the planning board, my earlier colleague. I'm his earlier colleague. We did a paper on the gender sensitivity of the government's pandemic response, where we discussed most of the things which have been discussed today on how, the types of problems which women faced. For instance, in terms of work, in terms of unpaid care work, in terms of violence, in terms of food provisioning, in terms of, in terms of these things, plus of course the health workers. How did we actually handle the whole health, the frontline workers, which are a huge force? Now, when we were doing this, we actually wanted to link it to our what we call the legacy of public action. Because why things happen so fast in Kerala is because we have a legacy of, mobilization happens very fast. So as soon as the pandemic came, there were these nurses, 8,000 nurses, 6,000 junior public health nurses, 66,000 Anganwadi workers, 26,000 ASHA workers. Then the government had formed a youth brigade, the young people, men and women, who also were there. So a huge mobilization took place immediately. And these small teams were made of these people, the health, the nurses, the JPHN, the Anganwadi, the Kudumbashri workers. And these teams actually were monitoring the health part of the thing. So we didn't have so much of hospitalization, though we have a very good public health system that is also there. But this mobilization that happened at the grassroots level was really what we helped in the whole quarantining of the whole thing. Now, what happened to these health workers? They were all mostly, as it was being pointed out, most of these health workers were women. But what happened to them during this pandemic? And if you look at the data, we've also shown by the data that whether in terms of equipment, whether in terms of masks, whether in terms of food or rations or anything, there was absolutely no, there was no limit to what was being done for them. Because if you look at the mortality or if you look at the people getting sick, there is no unnecessary higher proportion of women or girls who are getting all this, you see. And in fact, we are even below the global average, the number of female deaths versus the male deaths. All this actually we have shown in the paper. I don't remember all the figures accurately, but what new things that I could think that we had done when I heard the others. One was, the government had taken this decision of very consciously focusing on women. So if it's employment, a very conscious focus on Narega, on Kudumbashri, which is a fully women's program. We have an urban employment guarantee program called Inequality, Urban Employment Guarantee Scheme. Then these small self-employment enterprises, which are being run by the Women's Development Corporation, by the Labor Department, and various other agencies. So the whole idea was, out of the 20,000 crore package, which was declared by the Kerala government, this was the first government to declare a relief package in March itself. 2,000 was for Kudumbashri, 10% straight away. Then comes the Inequality, and if you look at the paper we have prepared, the women being employed in the Narega shot up tremendously during this period. We've shown that data to show that. So employment at the lower level was being guaranteed very much. And in fact, Ritu, you will be interested to hear, unless I've said it earlier somewhere, work participation rates in Kerala have gone up. During the flood time, during the pandemic, I'm hoping, let's see what the 2021 data show, but during the flood time in Kerala, 18-19 was the flood thing, because of this focus on women's employment, our work participation rates for women went up, and we are now above the all India average. We had always been below the all India average. So that was one thing which happened. Second, the violence. Now in this employment thing also, second, the violence. The violence, of course, a lot of helplines. We have 2 or 3 helplines which have been working very actively during this period. Of course, the violence went up. We are not denying it. The Women's Development Corporation has got a helpline. Then our Kudumbashri has a help desk, gender help desk. All of them were getting definitely much more calls than they were, but they were all there to provide relief. And, women, as you know, the internet penetration is much higher in Kerala. So most of the people will have some type of mobile device. Most women do have it. So they were able to, and women and child development had just a number. So you just had to press the number. You don't even have to talk or anything. You press the number and your thing is registered there. So lots of these things were actually done at that time, including psychosocial counseling, which was also another table we have shown how wonderfully, the women, the number of calls which are coming because of stress, the stress of the whole pandemic, and how the Kudumbashri, as also the Women's Development Corporation, and there was another thing called, we have got a thing called, I'm forgetting the name, Sitalayam, that's a homeo thing, and another one for the in the allopath thing. But all these helplines were there to actually look after that, the psychosocial plus the physical violence part. I'll finish off with saying the food, another new thing that Kerala did. I mean, that was absolutely fantastic, and that also actually served the migrant workers so well. The chief minister had announced nobody should go hungry. See, there were community kitchens set up by Kudumbashri and the local level governments. Each panchayat had community kitchens. Okay, we've also got the number of meals that were being cooked, and these meals were being reached to people who could not access, who could not come out of their households at that time. You see, so this sort of no one going hungry, community kitchens, free rations, and ration kits which contained more than just rice and wheat. The 17 items of consumption. This was and above all, Anganwadi children, right from the day the Anganwadi is closed, the next day the notification went that all the 33,000 Anganwadis, we should have their rations, daily rations for 15 days delivered to their house as dry rations, of course. For 15 days, each child got their ration, which continued after the 15 days also. The pandemic went on. Midday meals, same thing. So, there was certain steps taken by the government which were very gender friendly, because food provisioning is a very important role the women play. If there's no food on the table, they blame themselves. Okay, we were not able to give any food to children or to the men. Then the unpaid care. Now there, of course, I can't say that one could do much, but there was one statement made by the chief minister who used to come every evening during the very peak of the pandemic. Every evening at 6 o'clock, we'll have a talk by the chief minister who gave us all the figures on the pandemic. And then he said one day, 25th March, because it's stuck in my head, household work is not for women alone. At this time, when the women are in the houses and the men are also there, it is their duty to help the women to finish the household work, to look after the children, any other unpaid work. I'm not saying it did wonders, but I'm saying it definitely had an effect, as our local women tell us. It did have an effect. So I'm saying this conscious effort to invest in women, it pays off. That's what I'm trying to say. And that is what is necessary. If we're looking at the future, we have to look at employment, all the aspects in which, child care, elderly care, transportation, violence, all this has to be taken into account consciously if we have to move forward for a better, I don't know what all I've missed out, but I wish people would read that paper, because we have gathered so much information about what the government did during that time and how consciously it looked after the women. Thank you so much.
Thank you, ma'am. And for those of you who want to take a look at the paper, Subrat has just posted it on the chat box. So you can click on it and take a look at the paper that ma'am was just referring to. Can we unmute Matty now? And then we have one question, which after we finish with Matty, we will go to this question. Yeah. Thank you.
Thank you. I hope you can hear me. It's just a question about whether in some of the countries or contexts observed, whether you saw any progressive fiscal policies in the revenue side as well. Because many of the COVID responses, we measure the spending side, but in order to spend, often governments need to raise that money either through debt or tax, or other means that governments have, state-owned companies. And we saw that in Latin America, there were wealth taxes in 2 countries, but actually some countries continued to cut corporate taxes during the pandemic, which could reduce available revenue. So it's just a question whether you observed that, and whether the revenue raising had an impact on positive spending, because that link, I feel, was broken in many countries during the pandemic, because the revenue to progressive social spending link, we assume is there, but actually one cannot assume that at all, because we saw much of the COVID response money flowing to corporates, especially where those elites have greater sort of elite capture of power in many contexts. But then in contexts where popular power is also present, that link to some extent was preserved. So a question about the revenue side. Thank you.
Yeah, Professor Diwan, would you?
Yeah, I was just going to say, can I take that? Yeah, that's extremely important, Matthew, because that's in fact the fundamental issue of what was done. You know, in India, of course, the taxes went down, revenue side went down a bit, but that's also mainly because of the reduction in the corporate tax, which had come in 2019 and which was reduced again now. But in the last year, there has been a huge increase in the revenue. And that is because of the increase in the fuel prices and in the cooking gas prices, which have more than doubled. All right, we have one of the highest tax rates on fuel and on cooking energy in the entire world, you know, and the highest cost of fuel, which is absolutely and totally inflationary. And this is something we've been talking about for a long time, that now one of the inflation rates is one of the highest we've ever had in India. There's a huge amount of revenue which has been collected, which has not been shared with the states, and also a huge amount of wasteful expenditure. There is also the fact that, you know, at the same point of time, there is, you know, what shall I say, a process of privatization by selling of public assets. All right, what is called in India the monetization, national monetization pipeline. So apart from the issue of privatization, which you have already raised, the privatization of health, the privatization of insurance, which has been there for the past several years, and now even the sale of public assets, which are seen as the private assets of the government. So in fact, the revenue is huge, but it is not being spent at all. And there is another issue in this, and that is one of transparency and accountability. So a significant amount of money which is collected, it doesn't even go through the accountant general, and it is seen as private funds. We have issues like electoral bonds, you know, which are the most undemocratic of all kinds of funding. So the revenue is there, but the spending is not there at all. And that is one of the, I think, the major issues. Now, just day before yesterday, the Central Bank of India has taken some stand on the issue of inflation, but that's going to be a huge, massive. So one is the rise in prices, and on the other hand is declining incomes. So it's not only the poor, but even the middle class, which has you know, been reduced by, at least last year, by more than 32 million, which in any case is a small percentage of. Yeah, this is an extremely important issue, and it's impacting India very, very negatively.
Thank you, Professor. Clelia, you raised your hand.
Yeah, just a couple of comments on there. Specifically in terms of measures regarding or targeting multimillionaires. And that is specifically important for Latin America in the sense that the number of multimillionaires increased in 40% during the pandemic, and the total like the assets, richness, income, all like summed up, increased by like 60%, 60-70%. So that was critical here, and that is also could be attractive for governments to target this, but it did not necessarily happen. The only initiative that took place immediately within the crisis was in Argentina. They decided to tax multimillionaires, but they did have already some steps in there. It got like extended, but it was introduced as a temporary measure. Again, going back to concepts, yes, probably initially that was the easiest channel for the law to pass, right? But then again, we haven't seen any changes around that. And I think the time given for this was 2 years. And if that is the case, we are close to seeing it ending, right? Regarding the impact that it has had in terms of income for the government. And also another specification here, but it was not necessarily during the crisis, because in the crisis in Ecuador, we had also like cuts of taxes or extension for payments and so on, as almost everywhere else. But in this year, there was not something targeting precisely multimillionaires, but the the structure for taxing was redistributed in the sense that we have a more progressive charge, just in terms of like income taxes, but still I feel like it was a big step given the context of opposition that the government had in that specific action. But still in Latin America, that's probably all I can say on that regard.
Thanks, Clelia. We have, Chennai, would you want to add to that? I was going to just come to the one question that's been addressed to you. So if you can quickly add, if you want to add to that, please feel free.
Okay, I can't see the other question. The question, oh, there we go.
Okay, it's basically, how can the post-pandemic recovery agenda be made more gender inclusive and responsive in the Southern context?
Okay, all right, great. Thanks for that. Maybe let me start with Matty's question. I wish we had seen, I think more wealth taxes. I know on the African continent, it's something that is really insignificant in terms of wealth taxes as a source for revenue generation. And it's not something we saw increase as a result of COVID. But I think in terms of progressive measures, although it wasn't revenue raising, so to speak, we did see many governments, not many, but some governments, for example, reduce their value added tax rates, and some as well reduce personal income tax. In an effort to try and cushion, various groups. So that was progressive, but not so much in a revenue generation way. In response to, I think, the question, how can the post-pandemic recovery agenda be made more gender inclusive and responsive in the Southern context? I think there just needs to be an intentionality about making gender central whenever engaging in policy discussions. I know, for example, Zambia, for example, they used to previously have sort of gender, what was it? They used to look at the budget and then essentially take a look at the gender implications of the same, really sort of speaking to their want to be able to identify, the potential effects of various decisions that they were making on women. I think to the extent that that is not central whenever there is policy making happening, essentially in a sense, you won't be going after more gender inclusive frameworks. And then, as I mentioned earlier, ensuring that women are at decision-making tables is very important, I think, to ensure inclusivity in that respect. Again, in the African context, is not something we see, but definitely could go a long way in ensuring that the response in that way is aware and caters to the needs of women. Thanks, Sarah.
Thanks so much, Chennai. Dr. Mridul, you have your hand up.
I'm sorry, I just forgot two very important things. And one was in this context of revenue. You see, there was no space to increase taxes at that time, absolutely none. But what was done in Kerala, and that's again what helps such things happen, is that planning machinery is in a way the planning board plus all the departments. So it's a sort of something which is all in one place in a way. So as soon as same with the floods, as soon as the pandemic came, immediately the departments and the planning board start looking at the sectoral plans. Where is it that we can take money from to give more now for the pandemic problems? So health got a lot of money from the other sectors. Then livelihoods. So local governments got a lot of money from other sectors, from other departments, of course, which didn't like it. But then, you have to be understanding about the situation. You may groan and grumble, but money was being taken like that from the different departments to be given for what was urgently needed, especially health and livelihoods. So that was one way in which the revenue problem was to some extent looked after, because revenues were anyway falling because of the GST fall at the national level. We are not getting enough. And it was very difficult to raise taxes at that time, you see. So that's one thing I wanted to say. That's one way in which Kerala tried to handle the situation. Second, I forgot to say that the one big measure we took to put money into people's hands were social assistance, either pensions or just 1,000 rupees ex gratia for 7 months. It was declared by the government. We'll give 7 months pension, or if you are not a worker and not getting a pension, over 7 months means it's a small pension, 1,400 rupees. If you are not getting that, then you get it ex gratia, being a human being who needs the money. So it was in that sense that cash was also put into people's hands. So those were the focus of as somebody just said, that you have to consciously focus on women. You have to consciously focus on women, plan for them. And that's what, of course, we are doing through gender budgeting also. You have to do that to be able to get the outcomes you want. So I wanted to say these two things. Sorry to butt in again.
No, thank you so much. Shruti, you have your hand up. We might run 5 minutes over, but I think we'll just take this last hand, that's Shruti's.
Yeah. Thanks, Sarah. Yeah, I won't take long. Actually, I wanted to ask about gender budgeting strategies, and I think to some extent it has been answered by Dr. Mridul, also Chennai, which is giving the example about Colombia. So I'll just share my observation, and we can leave it there. So I was basically just reflecting on, given all the challenges that we've discussed today and the context, how much can we really rely on this strategy of gender responsive budgeting by itself to address some of these problems? The constraints go far beyond that. So even if we have some of these processes in place, if we don't have, as Professor Diwan said, we don't have the democratic space, and if overall we see a shrinking of social sector spending, then how far can we really go with gender responsive budgeting tools and practices which are explicitly there in the policy framework. So I think that's just something to think about, that it really has to be a concerted effort. Along with these processes, we need that commitment to spending on social protection, and we need space, we need women in decision-making positions. And unless we have all those, it becomes difficult to sort of rely on these strategies to really channel resources where they need to go. So I think that's also what came through in what Dr. Mridul was saying about how things have worked out in Kerala. A lot of things coming together. So that's all I wanted to share. Thank you.
Thanks so much, Shruti. A lot of food for thought over there moving forward. So now I'll very quickly request all our panelists to just make short closing remarks. We don't have too much time, but it would be good if we could just, hear your one key takeaway or, your concluding remarks to this webinar. So this time, I think we'll go in the reverse order from how we spoke. So I'll request Professor Diwan to start, and then we'll have Chennai, and then we'll have Clelia.
Lots to say. One is not enough, but at least flagging. One, of course, is the issue of planning. I think Kerala and maybe Rajasthan and Karnataka are the only ones who have planning boards. Otherwise, planning has been scrapped totally from the national scenario and from most of the states. So unless you plan, unless you have a vision, nothing is really going to happen. One is that. Second, of course, is, the issue of what has been raised right now, and that is gender budgeting and gender responsive planning. At some level, gender GRB, what we call gender responsive budgeting, has been reduced by in application, when we talk about whether it's a ministry or whether it's somewhere else, has been reduced to a sort of a, red and black CA chartered accountant exercise. It's not that. It's much way beyond. I mean, I'm not going to the tools and definitions of gender responsive budgeting, etc., etc. But also we have to link it to what I call a broader concept of feminist finance. It's that is unless you have that perspective, the broader macroeconomic finance perspective, then we are not going to be able to really understand what is happening. I'm not downgrading GRB. It's something very important, something we all work on. But also, I think the need to take a broader issue in mind.
Thank you, Professor. Chennai?
Thanks, Sarah. I think for me, two things. The first is that it's already been said that the COVID pandemic is really just the beginning of a series of sort of global issues we're going to see to this degree. So I do think it's important moving forward, because of the lessons that have been learned from COVID. Our governments need to start being, as I mentioned earlier, much more intentional about putting measures that will cushion, sort of the most marginalized and most poor in our societies. Often, this tends to be women. So I think that's the first point. And then the second, I think, to Matty's question, particularly for the African context, we don't place as much attention as we should on wealth taxes. And I think we saw during COVID that there was actually a group of people that benefited unseemingly, right, from the pandemic. So ensuring that we are taxing the wealthy to be able to support those who are sort of most in need in our societies, I think is something we need to be intentional about. Thanks, Sarah.
Thanks, Chennai. Clelia?
Yeah, well, I think there is not enough time to say much about this, but I will summarize this with three main messages, personal messages, more than from my organization or the studies. And the first, I think any approach to correct this, as well as any measure that we are trying to push with our work as civil society representatives, must be both integral and coherent. Like, really ask ourselves, how much are we doing that in our own processes, right? Before trying to extrapolate this to other spaces. The second would be, this is not a favor, it is an obligation, a social homework, a social task we have to guarantee that our women, our gender minorities, and everyone, especially those facing multiple vulnerabilities, to access to their rights and to be able to live them, to be able to have the same opportunities as everyone else. So that is also the call regarding the shift of concept we have talked already within the discussion. And then the third and last idea I would like to leave here is that, as I said before, again, our approach is valuable and is necessary as citizens, as civil society representatives, as policymakers, wherever our space, as academics, wherever the space we are in. But then again, if the problem persists, there should be something we must update, we must challenge in our approaches. So that is, those are the three ideas that I wanted to share with all of us, like a self-reminder as well.
Thank you so much, Clelia. And personally, I hate being the timekeeper here, because I think we can go on discussing this topic for at least another hour or two. And, it's interesting that, what was evident from all your comments and observation and presentation was the fact that so many of the issues we're discussing today are common across not just countries, but continents, whether it's to do with employment or the emotional needs of women during this time, social security, service delivery. And it's so important, and no amount of discussion can really ever capture the details to understand, how best we move forward, how do we address these issues, how do we as civil society come together. So yes, on behalf of CBGA and Feminist Policy Collective, we would like to thank our panelists for their time, their insights, and for joining us in this webinar. We'd also like to thank all the members of the audience for their time, for spending their Friday evening with us, for their interest and engagement. And with the pandemic still raging, there is an urgent need again to understand these issues, to build solidarity among feminist organizations, networks, researchers, activists, and policy professionals across the southern region. And the webinar today was just a step in that direction. And we hope you enjoyed listening in. And we hope to see you at our next event. Thank you so much.